Hey everybody, what's going on? This is Micah with Dr. Ozone. I was pretty excited for this week's episode of Ozone Therapy Expert Interviews. We talked to a world-renowned pharmacologist in the area of ozone therapy, Dr. Lamberto Ray. Dr. Ray is a professor of pharmacology at the university he works at in Italy. He has sat on the editorial board of many prestigious medical journals. So I was really excited because this guy knows the in and outs of the biochemistry of ozone therapy. He is also one of the world's leading researchers in ozone therapy. So today we covered a number of topics ranging from the basic biochemistry of ozone and how it works in the body, the precautions of dosing with ozone therapy, and how ozone may intervene with aging. As a pharmacologist and a medical doctor, how did you get involved with ozone therapy?
So this is a very long story. So
okay.
I started about 25 years ago. So before that time, I never heard about ozone. So what we knew before was simply that ozone was considered mostly as a pollutant. And so when for the first time, as you know, I am a pharmacologist for 40 years of my life, starting from 1975, I work on the neuromuscular junction. So very, very complicated pattern by a physiological and pharmacological point of view, with very good experience, and I was really happy with my work. But you know, being a pharmacologist, at the end of my life, I saw that sometimes there was the failure of medicine. In many cases, there are a lot of side effects. So at the end of my career as pharmacologist, that actually I am now a pharmacologist, so not at the end of my career. At the end of that time, in my mind, I opened my mind to new different possibilities to help suffering people. Because you know, by pharmacological point of view, what we can use are chemical, and we use chemical, for example, are agonists. If we want to increase the heart rate, so we can use an agonist, adrenaline. And if we want to reduce the heart rate, we can use an antagonist. So what does it mean? Does it mean it's very simple to study, very simple to reach scientificity, because I can give just to some receptors one substance that's similar to adrenaline to reach the same results. But that does not mean to follow exactly what our body wants. Because we know that our body is the best machine to healing itself, my opinion. And now I am more and more convinced about this. But at that time, so our possibilities was medicine, agonist and antagonist. And in the same time, was about 1993, I was in Cuba with Professor Olga Sonia Leon. And for the first time in my life, she explained me something very interesting that so far is very actual, but so far nobody exactly reached to characterize by a scientific point of view. So she told me, Lamberto, why you don't try ozone? But Olga, ozone is simply a gas like oxygen, so no receptors. How could be important by a pharmacological point of view? She told me, look, ozone is a strong oxidant. So if you use this strong oxidant at very low concentration, it could be possible that our cells, because all our cells use the same physiology, the same biochemistry. The biochemical pathway of our cells is to burn oxygen. Burning oxygen, we produce energy. And this energy makes the cell sometimes dirty.
Okay.
And she told me, okay, if we give a small oxidative stress below the threshold of damage, so you know, I can open sometimes some brackets just to understand what is harmful and what is not harmful, because this is a concept that only a few people can understand, talk about this. What is a venom? All is venom, nothing is venom, you know. So also wine could be a venom. Also water. But sure, water is need. We need, our body need water. Only high quantity of water can damage us. So the idea that small, brief, oxidative stress could be counteracted by the cells itself, destroying immediately the amount of ozone, the amount of oxidant, but in the same times transfer this information to the DNA, and the DNA start to produce some protein that counteract the damage induced by this oxidative stress. So you can imagine, this was in 1993.
Okay.
And I want to tell you that only 2 years ago, we found something that could well fit with this idea. Also, if at that time, Professor Ragazzone Leone and me too in Italy, we started to do some experiment just to test if really a small oxidative stress could be able to induce an antioxidant response by the cells. Because my idea was that if this is true, it could be possible that we can have benefit in all the cells. It's important just only to make protocols to make possible that ozone can reach one kind of cells. So this is the idea. But I want to go back to your 1, 2, 3, 4, 5 question. Ozone is harmful for the lungs. Okay. At that time, exactly, I start to do a research on the web regarding the literature, the scientific literature regarding ozone. All, I don't know, thousand reports regarding ozone. Ozone is toxic for lungs. So at the first, this was really, how could be possible? How can we use something that is so hard for some tissues? Only later on, also Professor Bocci says, we discovered that the reason why ozone or any other toxic substance is toxic is just because on the other side, so on this kind of cells, there are absolutely no antioxidant defenses. So for example, in the lung, in the alveoli, the fluid, there is no antioxidant at all. So if we don't have antioxidant, only a small amount of ozone and oxidant could be hurt to the lungs.
And what about, sorry, I didn't mean to cut you off there, but what about infusing ozone into the colon? Is there an antioxidant defense there, or what kind of effect does it have on the gut biome?
Yes, as you can see, as you know, and I was telling you before, you told me that there are a lot of protocols all around the world. Mm-hmm. So I visited China, I visited the United States, I visited Spain, Germany. Most of the doctors use different concentration. And these different concentrations are important because any kind of tissues is its own antioxidant defenses. For example, in the blood, the antioxidant defense is very high in the blood. So in the blood, we can reach very high concentration because we have always remember that we have to use the concentration that is below the antioxidant capability of the tissues where ozone will be injected. So in the colon we have a medium. So usually we don't give any heart any problem using concentration, low concentration, because ozone is important because we have the possibility to use it at very high concentration if we want to sterilize. For example, if we have infected wound, so by not systemic treatment, but topic treatment, we can destroy all the virus and bacteria, but this very high concentration must be more than 80, 90 micrograms. Usually in the colon, if you use the correct concentration, so below the antioxidant capability, the only response that you can have is an adaptive response from the tissues that start to produce positive protein that protect against this oxidative, but without any other damage. To my experience, and also the experience of Cuba, they have a lot of experience of rectal insufflation in the colon, so we never heard about problem at this level.
Okay. So as I'm understanding it, as long as you're not exceeding the antioxidant threshold of the tissue that you're administering the ozone to, there's not going to be any harm done because the antioxidants are able to basically absorb the ozone, but that starts a biochemical process.
Exactly. Exactly. That is, so it's like I give you a kick to you. So if it's too strong, I kill you.
I don't want that.
And if it's too soft, I love you. But if it's the right range, I don't kill you, and you will be able to give me a response. Just the same. This is a traumatic stimulus, a mechanical. In the case of ozone, is an oxidative stimulus. And I will explain later what is so exciting. Why I am so excited now with ozone therapy. Because we know more about this systemic approach. So when at the beginning, when you started this conversation, I told you, when I use adrenaline, I increase the heart frequency. When I smile, a lot of neuromediators in my brain go to the right neuron, and if I am sad, there are other neuron. So I am modifying my status, just simply myself. So what I want to say, that instead of put medicine in my brain to be happy, serotonin, or some other GABAergic or acetylcholine to be sad, I want to give you something that make possible that your body will respond with the right response. So that means epigenetic. We have in the DNA the possibility to do everything. And you can imagine if with this oxidative stress that is not so harmful, not so high, I can give an information. Because many years ago, when I was invited in Dubai, some people there told me, "Hi, doctors, the prayer in the morning, very early in the morning, when the right sun will save your soul, and one gas will save your body." So I don't know. I ask immediately, please give me where is written this, because really, I usually, since that time, when I started, and in the literature, only pollution regard to ozone, I started to ask also to my students during my lessons in the medical faculty, if we come back just 100 years less, we can't find the bad ozone. So the bad ozone, the pollution, is produced by man. In the nature, after a storm, or during the rise sun in the morning, when the oxygen go out from the hill and from the harbor, we can a very small amount of ozone. And coming back to our body, so our body, God, I don't know who, put the man on the earth. They told you want to live here, okay, I give you the possibility to live here, but you must know that if you want to live here, you need to breathe oxygen. And if you breathe oxygen, you will die for this breathing oxygen, the oxidative stress. That means that when we born till when we age, must be an homeostasis between the oxygen that burns in our cells to produce energy and the antioxidant capability. I suppose that in our body, some people put one sensor just to verify that all this process is in equilibrium. If this process is not in equilibrium, could be possible that the cells start a protective reaction to come back. I don't know if it's clear this concept, but 2 years ago, just reading one paper, very beautiful papers on pharmacological reviews, it was introduced in systems medicine. So systems medicine does mean not to treat the illness or the disease looking at the mechanism, the pathologies, but looking at the mechanism that is below. And this paper was really wonderful and was published in 2018. And reading this paper, so a new approach to medical therapy, not organ therapy, but adaptive therapy. So, and it was introduced the concept of this sensor, that is one sensor that controls, that check every day the level of oxidative stress inside the cells. If the oxidative stress increases, this sensor, that is one protein that now it has been identified, it is the NRF2, this protein start to move to the DNA in one area that now I read yesterday just another paper. It seems that this NRF2 control about 1,000 of genes. Among these genes, there are a lot of possibilities to healing the tissues. So we have genes that modulate the immune system. We have genes that modulate the circulation. There are genes that modulate the inflammation. There are genes that modulate the tissues remodeling. And does it mean that if we can put all together, ozone could induce a powerful response in several diseases that at the base, as mechanism of action, as oxidative stress. As we know, oxidative stress itself is responsible for aging.
Yeah.
Oxidative stress is responsible for cancer. So I don't want to talk, to give any hope to nobody. I am a scientist, and okay, it could be possible that I am a stupid man, but I am not a stupid scientist. So I know very well that there are thousand people with beautiful results, but we lack so far. What is the connection? Why these people come in our clinic to pay and feel good? In 25 years, I treated many people, and I can promise nothing more because ozone really could be a resource. I don't think that is a therapy, it's a resource. It's like sport training, or like you eat diet, no? If you eat good, or if you have sport every day, your body, the level of oxidative stress is reduced, and the possibility to counteract the effect of this problem is reduced.
So as I'm understanding it, so this equilibrium of oxidative stress is something that we want to maintain. We want to have a homeostasis of oxidative stress, antioxidant, oxidative stress, antioxidant. So what you're supposing with ozone therapy, what is going on is that we're stimulating under the antioxidant, or under the antioxidant.
Modulate.
Okay.
Also modulate some this upregulate or downregulate. So the difference between ozone, for example, or agonist and antagonist, just to come back to the previous example, agonists always induce a positive effect. Antagonists always induce a negative effect. In the case of ozone is not a direct molecule give the final results. The final results come back from the upregulation of these genes that modulate one kind of response. For example, the gene that regulates the inflammatory response, if there is an inflammation, they can induce the production of anti-inflammatory cytokines. If we have excess of oxidative stress, the gene that produce, for example, superoxide dismutases or catalysis, they start to produce more protein, more antioxidant. So the response is a different level I come back to the papers that I mentioned before. This paper was published in a very high impact factor journal, but they are looking for some substance like curcumin that can modulate the release of this NRF2. Nobody talk about ozone therapy because really it is not easy, for example, quantify the effect of this mild oxidative stress. So, you know, one of the problems that we have with ozone therapy is that the response from the patient are completely different. It's very difficult to put all together one single response for every patient. Mm-hmm. We have some patients that after one treatment feel good, other patients that need more than one therapy. So this is the reason why we need more studies about this. But if you look for some substance that can increase the modulation of NRF2, it is not easy to do this for ozone therapy.
Just a quick message with a close-up face. Just a quick message here with a very, very close-up view of my face. So as you're going through this video, you might be wondering how you would get set up with ozone therapy. Dr. Ray has a lot of knowledge, a lot of gems that he's passing off here, but you might be interested in actually doing ozone therapy. If you're interested in getting set up with ozone therapy, click the link below in the description of this video, and we will send you some videos, booklets, and even articles that have been written by Dr. Lamberto Ray. He set forward the standard of ozone therapy worldwide, or was a part of it. So you can get access to all of that information. Just click the link below in the description of this video, and those will get sent to you right away. Back to the video. It seems like a really good therapy that produces a lot of beneficial results. Why are they so opposed to ozone therapy when there seems to be not enough scientific data to tell us definitively what is happening, but there's enough scientific data to pose a question: is ozone therapy worth studying more? And it seems like the answer is yes, because there's quite a bit there.
Yes, but the problem is that we do not have enough sponsors to do this kind of research. So, you know, I told you before that many scientists are looking for some molecule, chemical, that can modulate the NRF2 pathway. But it's not possible to put money to study ozone. So ozone is not stable molecular, you know. So it's not possible to go to the pharmacy. So we will not have back a marketing. This is the reason. If we don't have if you have money, you put your money to study some things that never will go back to you. What you put as sponsor is very difficult. So this will be something that also the conventional, the Minister of Health, they had to start to study and to fix the problem. Okay, it could be possible that ozone could be helpful now. We have only the evidence-based medicine. So we know that a lot of people all over the world is doing ozone therapy, is happy, pay. But really, we don't know exactly how is, by a scientific point of view, how can we check this? So to do this, we need to do, for example, clinical studies, but with different concepts. So if we study an holistic response, it's very difficult to study. If I had to design a protocol, a clinical protocol, to verify the effect of ozone, for example, in the disc herniation, okay, I can do this. In this case, it's very simple because we can see the disc herniation before and after the treatment. And there are many works, many papers. This is the reason why, for example, in the case of disc herniation, there is more acceptability. But in other cases, for example, in the age, so what can we do is an epidemiological studies coming back, but who pay for this? Who pay? I have to pay myself. It's not possible. And I need some sponsor. So sometimes I try to talk with the Minister of Health or the institution, to telling them, okay, this time we do not have enough money to pay all the cure, all the medical treatment for the people. In this time, thanks to God, We have the people that live 10 or 15 years more. So why we don't look to the possibility to use this resource to all the people to reduce the damage of aging? Because we know that aging is oxidative stress, in the unbalancement of this antioxidant and pro-oxidant. So if we are sure we have enough data that, for example, one of the genes promoted by ozone at low doses is the antioxidant, we need a study to verify this condition. But this study means money. So you can't go to the pharmacy and buy 1 kilogram of ozone. So it's not possible.
Yeah, and it's just a very unfortunate situation because, I mean, it's just in the margins. I mean, so ozone therapy is something that seems like it would be really effective, but with the way the system is set up, there's just not much opportunity for you to study it unless you have, you know, somebody who just wants to essentially donate money for the benefit of humanity.
So you're right. It's a very complicated pattern. So I don't want to fight with nobody. And usually all over the world, I try to talk also with my colleagues. Because we have a lot of people asking for this treatment, and the people feel good. Okay, but this does not mean that we reached the right to propose. We need some help, and we need also, what can I say? I told you before, I visit a lot of countries all over the world, in the United States, in Latin America, in China. So there is, the protocols used are completely different. So now we are trying with the World Federation of Ozone Therapy to start to give some suggestion, not protocols, because the protocols does mean strict rules regarding the administration. In the case of an holistic systemic approach, we can't have these strict rules. But every therapy, every treatment must be personalized to the people. So it's very complicated, but we are trying to do this suggestion. For example, use this range of concentration, looking at the status of the patients, but not one concentration for each illness.
Okay, I didn't realize that was the purpose of the ranges, is just to give more autonomy to the doctor to be able to do what they think is a beneficial thing for the patient. So I see, so that kind of leads me into another question. You see people doing a very low dose, like Hansler, you know, did his paper on the low dose concept of ozone and how using a very low dose of ozone can stimulate a beneficial result. But you have people on the other side of it doing like 10 pass, like Dr. Lahadny. What would be your opinion on some of those higher dosages of ozone therapy?
This is a very big question.
I know. I don't want to throw you in the hot water.
I am in the middle, but I am in the middle not because I don't want to take a position in this. I know, as I told you before, that when we talk about blood, okay, the range could be very, very high. Mm-hmm. Because in the blood, you can start with 10 and we can arrive to 70. And the problem of 10 passes, for example, okay, could be possible that it works. I don't know. And I am sure that patient treated with 10 passes feel better. But the problem is the anticoagulant. It's not the amount of ozone. Because as I told you before, the antioxidant capability of blood is very, very high. So what does it mean? That in any condition, all the people follow to be submitted to ozone therapy. Does mean that the molecule, if it's not damaged, and so you can't breathe. Nobody so far proposed of our colleague to give ozone by mouth breathing because it's not possible. You kill the people, okay?
Yeah.
But in any other case, you have very large range of concentration. And the final results is that most of the people feel good. So, to my opinion, we need to consider, to revise, and to study this phenomenon. Mm-hmm. What can I say? It's like you have every day you have training, training, training. But if you give training higher than your possibility, you can die. You can have a cardiovascular death. So, but in the range, you can walk for 50 meters a day, but you can walk also till 150 meters. No, it's the same. If you walk 50 days, 50 meters only a day, perhaps you need longer time to reach the best result, the best performance. But the range is very high in that condition. So usually I used to this kind of paragon, how can I say, just to talk about sport and ozone. So, also the problem of doping, is not possible. I never want to, is absolutely not correct to talk about doping with ozone therapy, because ozone therapy is not a medicine, absolutely. Ozone is not the medicine. The medicine is our body. Mm-hmm. Now it's clear this. So if I am trained, sure, I run better than you if you're not trained, but does not mean that if I am trained, I am doped, no? So that is the reason why.
Well, I have a number of questions from that. I think the first one is you hit on what seems to be a phenomenon with ozone is that you have very low doses of ozone that are stimulating a beneficial result. And then you have very relatively high doses of ozone therapy that are stimulating a result. So it's like, man, there's a very big operating window for ozone therapy here. And where that exactly sits and which one is the best one, it doesn't seem like we're too certain of yet.
So my opinion is that we have to use in relation to the body weight of the people. So this is one. We can't give, for example, 10 micrograms or 50 micrograms to all the patients or young people. The body weight is 20 or the body weight is 70. So this condition must be considered in the future. And sure, some people told you if we increase the concentration, but we don't have any relationship between the concentration and the modulation of NRF2. Mm-hmm. So for the future, what we need, it could be possible, perhaps, that the modulation of these pathways, biochemical pathway inside, but there are many other, because now we are studying, for example, in the case of arthritis of the knee, there is one protein that is MDM2 protein that seems to be involved in the osteoarthritis, and also this protein could be upregulated by low ozone doses, low or high, we don't know. Now what we need, but I don't think that there are papers so far published in this kind of field. I want to see, for example, 20 micrograms are able to modulate NRF2 for how many days, or 60 micrograms, so 6 times the same concentration, every different results in terms of modulation, because as you know, ozone is simply just, I give you one stimulus, and all the other things inside our body depend upon the transmission of NRF2 to the DNA, the protein synthesis also that is different, and there are also other, for example, supplement that we need to supplement, because also if we increase the protein synthesis of some antioxidant like superoxide dismutase or catalase, we need, for example, that our level of selenium and other magnesium and other mineral oligo element that are very important, because they catalyze the reaction, the enzymatic reaction. So if we give ozone to one patient with low level of this oligo element, we don't have any results immediately. There are a lot of variables, and I have in my mind now, I am approaching a randomized study. Perhaps you will start, because I found one sponsor of myself. There is big people here interested to do this kind of research. So I want to start to do a randomized clinical studies on 30 or 40 patients just to see if the modulation is modified by the concentration of ozone in the blood, starting from 10 and arriving in 70, 60.
For ozone in the blood, if you exceed, I know this might not be a great question to ask either, because I'm sure there's some controversy there, but the standardization is not to exceed 80 micrograms per milliliter per ml of blood. If you exceed 80 micrograms per milliliter per ml of blood, what happens? Because I know that we don't see an immediate lysing of the red blood cells. So that you have to exceed even more than that to get actual lysing of the blood cells. But what happens in between those places, I guess?
So the problem is the white cells, not the blood cells.
Okay, the white cells.
So the white cells. So because we need the red cells, the blood cells, the erythrocytes are really not so important for the response. No. Sure. So if we kill, we know every 3 months we have new erythrocytes, so no problem. The problem is that the white cells. So when we give the conditioning, oxidative conditioning with ozone, really we modulate the activity of the white cells. And very high concentration could be possible that they are not able to respond with this. There are some not paper, but demonstration by Nazarov now about high concentration. So, but really, I want to start low and not to reach this kind, because there is to my opinion, there is any evidence that really this high concentration give better results so
far. Okay, yeah, that's a fair statement. And so with the white blood cells, what is it doing? Is it killing them? Is it deactivating them? What is it doing?
Yeah, they activate. They can't activate the area, the gene area, to produce the response to the stimulus. That is the problem. Okay. If we kill erythrocyte, no problem. Not important. So,
no problem. Just don't worry about them. Yeah.
They are dead cell. They just transport oxygen, but we have only a few parts in our body, in the bottle.
That makes sense, because I was seeing some of the stuff from Professor Nazarov as well, and there's been some other questions I've had on that topic, because there seems to be more of an increase of these high dose therapies and what seems to be exceeding the standard that has been set forth. So thanks for adding that in.
So the standard is very difficult to do stuff. We are trying now. I am trying to in the next Congress in Chile in November, we have a meeting of the Latin America societies, and we are preparing some guidelines, but not really guidelines, just proposal. And for example, I do not agree to forbid one technique. I am open to every kind of technique. We must be absolutely open to all the colleagues that want to try different, because if they are able to demonstrate that there are beautiful results, okay, no problem. But what sometimes I suggest to my colleagues is that so far ozone is not. So we know all the people works all over the world. So the health authority forbidden this kind, I don't know, officially, formally forbidden this kind of treatment, but they are silent. So I can't understand. I try to have some evidence, written evidence about the use of ozone in the clinic. So this is very strange. We can use ozone. There are formal forbidden about this, but it's tolerated. So the people can use it. So I can understand where is the truth, no? Health out also in the United States, for example, I know that in New York, in other states, it's allowed to do ozone. It's not forbidden, but it's not accepted by Food and Drug Administration. Mm-hmm. Oh, why? Or you close or you open.
Well, I think part of it is they don't want to have to regulate it, and it's so set up, like you were saying earlier, for the studies and the money that funds those studies, that it just doesn't give much room for these other therapies, because if they said, yeah, ozone works or ozone does something, then all of a sudden they have to make a genuine attempt at regulating it, where if they just say no ozone, they don't have to do anything. They can just say no. So, and they're already at capacity, you know, they're doing a lot of different stuff. So I think it's just one of those things that's been left in the margins, and there's not much hope until somebody is going to sponsor, like you said.
But I am sure about this, that this, we are not ready so far, really. The world is not ready. And I am sure that this will be the therapy of the future. I don't know if after my or that, I don't know, but will be the future. Because when some fixed rules will be discovered, ozone is a resource for all the people, I suggest my friend, my family, you don't wait to be sick, please. Ozone before, ozone prevents the damage of aging, prevents that one cells became sick. So you can imagine, if this cell is one cell of my brain, I can have neurological disorders. I don't want to say that we can cure, that you can prevent Alzheimer or Parkinson, I don't know. But there are no medicine. These people that is growing, because it's growing the age, must be treated with some things. And so it is obvious that now, if we have some biochemical evidence that ozone therapy reduces the damage also of the neuron, if one neuron is in perfect status, sure remain healthy, avoiding that some disease or illness occur. That is important. Reading these papers, we can see that this NRF2 controls many diseases, apparently heterogeneous.
Mm-hmm.
So it is possible to think that ozone modulate NRF2, so ozone can be helpful. I don't want to say that I will be cure everything. So we don't have the proof, because I don't have 10,000 patients treated for this. That is the reason.
Mm-hmm. Yeah, and I think that's one of the very simple things that almost sounds stupid to say, is the best way to not get sick is to not get sick. You know, just by staying healthy and doing the things that are good for you. And ozone therapy is one of those, it seems.
Exactly.
So what are the primary, if you had to list out the primary pathologies that you see a beneficial response to the ozone, what might those be?
So what can I say? So the back pain is absolutely the first back pain.
Herniated disc?
The pain, yes, now I am writing this, one chapter for one book to treat the cancer pain, because in cancer pain, just complementary to chemotherapy, we can reduce the pain. So in this context, we have the evidence of wonderful results. So what can I say? Also in the aging, I have many observations. So you can see, for example, in some people, all elder people, that they can reduce the damage of aging, really. And another situation in which we can have a good result is hepatitis. Hepatitis is wonderful if you have high level of transaminases. After autoimmunotherapy, the blood treatment, we can reduce this. So in the immune modulation, you can prevent, for example, adding some vitamin C and other supplement. You can increase the modulation system. This is usually the best. So I don't want to talk about cancer. There are many colleagues that are working on this with excellent results. So I open my eyes I opened my mind to everything. But as I told you, I am in love with Ozone. Ozone is a small baby, and we had to take care about this baby because we don't want to kill him before he grows. Because I am sure in the next future it will grow a lot. So we must be very intelligent to stay quiet, to do our observation, if possible, to put on journals our clinical results, also if not randomized, some case report. I published some case reports, only one case, two cases, but could be indicative of good results. Mm-hmm. So maintain a low level, open to avoiding to fight within us. And this is the reason why I accepted to go in Chile the next November. In Chile, in my conference, I want to put all together, and also in Aruba the next year, where they invited me. So there are several groups of ozone therapists, and I am in love with all the people because these people have an hope. The hope is to help people, suffering people. Mm-hmm. I am a pharmacologist, and some people inside my group tell me, Lamberto, at the beginning, you are wrong. Now, most of my colleagues tell me, you are right. Please go on, but slowly. That is, for me, important. Mm-hmm. We could see every day people suffering. Okay, medicine are wonderful. Okay, we did some good step, but most of the people in rare illnesses so far die without any possibility. Sorry. So I am not in love for ozone for myself. I am in love for the people that suffer, and there are no possibility for them. Mm-hmm. And there is no doctors all over the world that can say to one patient, no, I am nothing for you. No. We have to look for something. Tomorrow is another day. Tomorrow, could we have more information that can help us to help these people? That is important. So this is the reason why I love all my colleagues working in ozone therapy. They must really deem to be here, not, I don't know, what can I say? They had to stay with the back right in front of discussion, tell them the opinion, and be sure that they are trying to help people just using something different, but in conjunction, not in alternative. I don't like alternative because nothing is alternative. Ozone alone can do nothing without some other help from medicine, for example, or from training or supplementation. Altogether, we can reach the results to help suffering people that so far don't have any possibility to be healed.
I appreciate your passion on that. And that's one of the reasons I love this group of doctors too, is because a lot of them, when they choose to do ozone therapy, they're putting themselves at risk. So they're not choosing it for the money. They're not choosing it for really any other reason than helping the patient. And that's why a lot of these practitioners, and not all of them, you get bad apples everywhere, but a good core of them really want to see their patients get better. And I think that's a large reason why ozone therapy is even where it's at today, is because a lot of these people are very genuine in their walk and in their care. And a lot of the people that discredit it, as soon as it became popular, they would accept it. It's just that it's not popular, that they don't accept it, and or there's not money in it.
No, that is very important. It's very important. Sometimes when we use an holistic approach or systemic approach like ozone therapy, it is important that you transfer your patient to your patient, because your patient must help you. So I don't. When I give a medicine, if I give you adrenaline or to you or to other 100 people, the heart rate increased to 100 people. Does not mean that I give you something good. But if I want that your heart come back normal, just giving you a small oxidative stress, I want to put your body in the condition to healing itself, to be sad or to be happy. To be happy now itself, my serotonin is increased. I am happy or I am sad because there is something I have to pay tomorrow, so I am very sad. This is the movement of my neuromediators.
Yeah, and I echo that. I mean, drugs are not the best form of medicine. Your body is the best form of medicine.
Absolutely.
And you can, if you can get your body into a state where it has that homeostasis, that equilibrium, you know, that perfect middle, you're going to be able to heal from a lot more things than any drug can do.
Sure, we can't go over our body. When we act on the receptors, we go over our body. And could be possible that our body lost the possibility to respond itself. Because it's like, you give me this, okay. If you give me heat every day, food, without that I do nothing, I don't force myself to go for a look.
Mm-hmm.
Because you give me, so this is important, that this holistic treatment is important because our body is the best machine in healing itself.
I agree. And I have a couple more questions here. One of the ones is that a lot of people in the USA seem to think that ozone therapy is very, very widely used in Europe. And I know that is kind of the scientific bed, especially Italy is kind of the scientific bed of ozone therapy. But could you explain what the actual state of ozone therapy in Europe is?
So in Europe we are using ozone therapy. In Italy, we have three associations, ozone association. This is one of other problems that we have. In Germany too, Dr. Fiban, they have one ozone association. They are using as a complementary medicine without any. There are some from the authority, from the health authority, there are no problem. Also in Italy, we don't have problem, but as I told you before, most of the people doing this because the patient start to ask, and also the Minister of Health is not approval, but accepted the Society of Ozone Therapy inside the data bank of the Medical Association in Italy. So this is very strong step that we have in Italy, not to formalize to approval, but to make possible to spread the treatment among other places. There are more medical doctors. The problem is that how we can prepare these doctors. So I was a professor of pharmacology in my university, in the medical faculty. I teach pharmacology, molecular pharmacology to my students. There are no difficulties. So what I know now is because myself, I try to study myself, or some society organizes some courses, but not official courses. So we do not have a university level one course that can form, that can give the right knowledge to doctors that want to start to do this kind of therapy. This is a big problem. Also, if always I say that is very, very, very difficult to act with doctors. Doctors must be really very, very hard to do because ozone is very safe. Also, if we have different possibilities to administer ozone, usually it's very difficult to some damage. In this context, it's very important that we can use good generators. Good generators, that is very important because we are the manufacturer of our medicine. So we don't go to the pharmacy to buy Voltaren or diclofenac or Bentelan and inject it. We are preparing our medicine here. So in the same times, we are the medical doctors and the manufacturer.
Mm-hmm.
we must take care in this moment, because it's very important that sometimes we have some people, some doctors that publish data against ozone therapy, telling infection, disease, infection, or but the problem was the technique used, not the ozone. So it is very difficult sometimes to try to defend ourselves from this very strange.
I think that runs me. Well, I do have one more question, actually. This is more of a side question. I recently did a video on ozone therapy in athletics, and there's honestly kind of an underwhelming amount of clinical data on athletes using ozone. But from your opinion, do you think that ozone therapy improves athletic performance?
Sure, it's like any kind of energy. But so one day, one colleague asked me, "Hi, Lamberto, how much oxygen we have in our body after ozone therapy?" The same like before. What we have, we increase the delivery of oxygen to tissues, just simply. But we can obtain the same results if we train our body for 1 month. So now, from tomorrow, I start to do a walk for 1 kilometer every day, because I simply increase the biochemical, the physiological pathways that are related to muscular activity. All these cells, when we give small amount of ozone, can increase their behavior. So I think better. So there are students that before giving an examination in the university come here to do ozone therapy. And the neuron, but not because I give a medicine. It's our body that start to perform better, but it's normal. It's normal.
Yeah.
It's like a diet. So if I eat every day spaghetti, bread, spaghetti, and wine, so my body fine too. But if I have a good diet, my body will be perfect. It is absolutely normal. So ozone reduce the damage of the life on the earth, simply. So we feel better, sure. But that's not me that is doping, absolutely. Doping is anabolizing, doping is erythropoietin. When I increase the red blood cells, start to increase the oxygen, the transportation of oxygen. I do nothing of this. Mm-hmm. I simply give our body, please work better as you can.
Dr. Ray, thank you for talking with us today. You are a pharmacologist from Italy. You went to Cuba and came back a changed man. I'm sure your colleagues thought you were crazy at the time, but it seems like it's been a very long but a very good journey for you in studying ozone therapy. And I just wanted to thank you very much for taking the time just to talk with us today.
No, I thank you very much, and
okay.
I hope to see you in your country. So when the next time when I will be in your country, it will be my pleasure to see you and to meet you and talk with you about this.
I just wanted to take a second real quick and say thank you so much for watching or listening to this podcast, this episode. It means a lot to me that you guys are out there watching and enjoying this, and I really love to interview people. I really love to make videos around the topics of ozone therapy because I'm passionate about it. I think a lot of people could potentially benefit from this, so I would love to bring the information that's already out there and put it into a more digestible format for people and raise the credibility and the general knowledge about ozone therapy. So if you appreciate these, one thing you could do that'd be really helpful is just either like the video or dislike it, comment on the video your thoughts, because that will help me put a gauge on what people like or dislike, and we can grow this community. We can grow the collective knowledge about ozone therapy together. But again, thank you so much. I wouldn't be here doing this if it wasn't for you, and I really, really appreciate your support.